Good morning to you and to all those who tune in every morning. As we have been doing lately, we start our briefing informing about the passing of patients, in this case, two patients that had been diagnosed with COVID 19. And we begin giving our condolences to the relatives, friends, and co workers in some cases for their loss. One is a 53-year-old patient with a history of liver cirrhosis, diabetes mellitus, high blood pressure, who had been admitted to the General Julio Aristegui Hospital in Cardenas, Matanzas, and he had been admitted due to a decompensated hepatic cirrhosis, who developed ammonial liver encephalopathy and renal insufficiency, two complications of poor prognosis. He underwent several tests, including COVID 19, and he tested positive. At the moment, it was decided to transfer him to the military hospital of Matanzas, the facility specially designed to fight coronavirus. His condition did not allow for his transfer, and he died in Cardenas, Matanzas.
Cuando ya se tiene se piensa, o sea, se decide trasladarlo al Hospital Militar de Matanza, que es donde se atienden los pacientes sospechosos o confirmados.
The second patient whose death we grieve is a female patient who had been admitted in the Manuel Fajardo Hospital in Villa Clara. She was 69 years old, from the nursing home number 3 from Villa Clara that we know reported several confirmed cases. This person had a history of mental retardation and dementia, and as a result of the screening conducted in this nursing home, she tested positive. To COVID 19. She was hospitalized and she began receiving the treatment designed for the disease, but her condition worsened with a progressive dyspnea, and she had a cardiac arrest. She couldn't be saved. This is the second reported death yesterday. And we convey our condolences. In our country, the situation remains similar in terms of the presence of foreigners, with 4,771 and 6,759 Cubans who reside abroad. In rental houses, there are 947 foreigners in the same municipalities of every day, and it's logical that this number does not change, since there are no flights coming into the country or leaving the country. The number of patients admitted to hospitals changes a little bit. We now have 3,546. 53 patients are under surveillance. 2,687 are suspected cases, and 806 are confirmed cases. At the primary healthcare level, we have 5,556 under observation. Some people notice the fluctuation of these numbers from one day to the next, and this is the result of some patients being discharged either because they have recovered after having tested positive, and others because they test negative, and it doesn't make any sense to keep them hospitalized. And every time a case is confirmed, that generates a number of actions like contact tracing that leads to the identification of suspected cases or other persons who have no symptoms who need to be isolated for observation to discard that they have been infected with the virus.
Además, continuamente, cada vez que se confirma un caso, y aquí todos los días decimos cuántos casos se confirman, pues eso genera un grupo de acciones de control mediante la cual se detectan personas sospechosas.
To detect the presence of COVID-19, yesterday our laboratories processed 1,823 samples, of which 20 tested positive. This represents 1.9% of the studied samples, a number much lower than those reported on previous days. At the laboratory of the Pedro Curie Tropical Medicine Institute, 849 samples were studied, 600 at the Provincial Center of Epidemiology and Hygiene from Villa Clara, 191 at the Provincial Laboratory in Havana, in Santiago de Cuba Laboratory, 183. These tests allowed the diagnosis of the 20 new cases. At this moment, Cuba already accumulates 41,651 samples, and 1,389 have tested positive. This represents 3.3% of the processed samples. Of the 20 new cases confirmed, all were Cubans. 19, that is 95% of them, were contacts of confirmed cases. And in one case, we are studying the source of the contagion. Of the 20 new cases, 9 are female, 55% were male, and 65%, that is 13 of the 20 confirmed cases, were asymptomatic. The age group with the most cases is the one from younger than 40 years, with 10 cases, followed by the age group of 40 to 60 years, with 9 cases, which is the 45%. The province of Havana has the most cases with 14 cases, that is 70%, and Matanzas with 3 cases. Of the 1,389 patients diagnosed with COVID-19, the 57.2%, that is 794, show stable clinical evolution. We grieve the loss of 56 people. As I said earlier, we had 2 more deaths reported today. Then we have the 2 evacuees. And we already have 525 people who have been discharged from hospitals, 24 people more than the day before. These 525 discharges represent 37.8% of all the patients diagnosed on the island. We are reporting in intensive care wards a total of 12 confirmed patients, 6 who are in critical condition and 6 in serious condition. These are the same patients that were reported in those conditions yesterday. As of 12 midnight, a country was added to the list of those with transmission of COVID-19, which was Western Sahara, So now there are 183 countries. There is a total of 2,844,712 confirmed cases. We are practically reaching 3 million. In one day, 99,968 cases were confirmed. In terms of the death toll, 5,228 died yesterday for a cumulative total of 201,315 fatalities, for a lethality of 7.07%. The region of the Americas confirms in one day 62,006 confirmed cases, for a total of 1,134,686 cases, and the region accounts for 39.08% of the number of cases in the world. The region also accumulates 63,649 fatalities, 2,897 deaths more than the day before, for a lethality of a 5.62%. That is the international situation.